knowledge adventure. Have fun. Get smart.
Save the patient. It's up to you. Doctor, we just received 4 new admissions, and they are all in serious condition. To interview a patient, get more information, or start a procedure, just click on the appropriate console. Click to start. The front entrance to the hospital is locked after hours. If you want to enter at this time of the night, you will need to go around back to the rear entrance.
Heart attack. People with coronary artery disease are at high risk for having a heart attack. A heart attack occurs when the blood supply to a part of the heart is suddenly cut off and the affected heart muscle dies. The usual cause of a heart attack is the formation of a blood clot at the site of an atherosclerotic plaque. The clot completely blocks the artery, cutting off blood flow beyond it. The medical term for a heart attack is myocardial infarction. A heart attack causes changes in the normal pattern of the EKG tracing, as shown in the illustration at left. Heart attacks are the #1 cause of death in Western societies. The risk factors for having a heart attack are well known. These risk factors include a diet high in fat and cholesterol, smoking, obesity, inactivity, high blood pressure, diabetes, and a family history of heart attacks. Fortunately, most of these risk factors are related to lifestyle. It is thus possible for a person to lower their risk of a heart attack if they choose to. Coronary angiography. It is often desirable to study the coronary arteries of patients with coronary artery disease. Many different tests have been devised to do this. At present, the definitive test for evaluating the coronary arteries is angiography. Coronary angiography is an invasive test that requires placing a catheter in the coronary arteries. Dye is then injected, and detailed pictures of the coronary arteries are obtained. This test enables doctors to determine the exact location and severity of the plaques within the coronary arteries. The photograph at left shows a doctor performing a coronary angiogram. Several new forms of treatment for coronary artery disease have emerged in recent years. The most well accepted is coronary angioplasty. Coronary angioplasty involves positioning a small balloon catheter in a coronary artery such that the balloon crosses a plaque. The balloon is then inflated to compress the fatty plaque and make it smaller. When the balloon is deflated, the plaque usually remains compressed. This increases the size of the arterial lumen, central opening, and improves blood flow to the heart. The heart. Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle it. These blood vessels are known as the coronary arteries. This illustration shows the heart and the coronary arteries. Under normal circumstances, the coronary arteries have significant reserve capacity, and they can easily meet the oxygen demands of the heart muscle. Problems with supplying the heart muscle with oxygen arise only when the coronary arteries become narrowed due to atherosclerosis. Coronary artery disease. Atherosclerosis is a disease which results in narrowed arteries and decreased blood flow. The arteries become narrowed because of a buildup of plaques within their inner walls. This illustration shows a yellow plaque within the inner layer of an artery. Plaques consist of a mixture of substances, including cholesterol, fat, fibrous tissue, clumps of platelets, and sometimes calcium. Atherosclerosis begins early in life, but generally causes no symptoms until middle or old age. Only after an artery becomes very narrowed will blood flow be diminished enough to cause symptoms. When atherosclerosis affects the coronary arteries, it is called coronary artery disease. Patients with coronary artery disease experience chest pain when the blood supply to the heart is inadequate to meet the demand for oxygen. This pain is called angina. Coronary artery disease is a very common ailment with characteristic symptoms. Angina typically occurs after a predictable amount of exercise, for example walking up one flight of stairs, and is relieved by rest. Medication is available that relieves the pain by briefly dilating the coronary arteries, but this has no effect on the underlying disease. Patients with angina are at high risk for having a heart attack if their coronary artery disease is not treated. The heart. Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle the heart. Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle it. These blood vessels are known as the coronary arteries. This illustration shows the heart and the coronary arteries. Under normal circumstances, the coronary arteries have significant reserve capacity, and they can easily meet the oxygen demands of the heart muscle. Problems with supplying the heart muscle with oxygen arise only when the coronary arteries become narrowed due to atherosclerosis. Influenza virus. The photograph at left shows a single influenza virus. Influenza viruses are responsible for the respiratory illness popularly named the flu. This illness is spread from person to person through the air by virus-infected water droplets that are sneezed or coughed up. Influenza generally occurs in local outbreaks. Outbreaks tend to occur in the winter months, spreading rapidly through places where many people congregate, such as schools, offices, and nursing homes. The typical case of influenza is characterized by fever, muscle aches, headache, loss of appetite, cough, and a runny nose. The illness typically resolves within a week and does not require any treatment beyond rest and fluids. Rarely, influenza will progress and infect the lungs themselves, causing a severe pneumonia that can be fatal even in young, healthy adults. Most deaths from influenza, however, occur in old people who develop bacterial pneumonia because the viral infection lowers their resistance to other infections. Influenza virus. There are three main types of influenza viruses, named type A, B, and C. The schematic illustration at left shows a single influenza virus. Among the most notable features are the little spikes, shown in white, that stick out from the viral surface. The exact nature of the spikes, glycoproteins, determines the type of the influenza virus. Immunity to influenza occurs when the immune system makes antibodies that bind to these glycoprotein surface spikes. Unfortunately, the type A and to a lesser extent type B influenza viruses are unstable, with new versions appearing every year. When a new version appears, the antibodies still circulating in the body from the last bout of influenza will be less effective at eliminating the virus, and the person may get ill once again. Occasionally, an influenza virus will appear that is so radically new that virtually no one is immune to it. When this occurs, the result is a worldwide flu outbreak called a pandemic. The respiratory lining. The photograph at left shows a portion of the lining of the upper respiratory tree. The lining consists of two main types of cells, goblet cells and ciliated cells. The goblet cells secrete a sticky mucus which coats the respiratory lining and traps foreign particles. The ciliated cells, shown in orange, have numerous tiny hairs, cilia, on their surfaces which continuously beat in unison. This action sweeps the sticky mucus with its trapped particles up and out of the lungs. Influenza viruses invade and ultimately destroy large numbers of the cells which line the respiratory tree. This, of course, impairs the function of the lining and causes people with influenza to cough. It also makes people more susceptible to other infections, since they are less able to sweep out other potential invaders. Of note, cigarette smoking is also very toxic to the cells of the respiratory lining. This accounts for the chronic coughing and increased susceptibility to upper respiratory infections seen in smokers. The lungs. The lungs are a vital organ which enables the body to obtain oxygen from the air we breathe and to eliminate carbon dioxide. The structure of the lungs can be likened to a branching tree. Starting with the trachea, windpipe, the respiratory tree branches initially to form two main bronchi, airwaves, that enter the right and left lungs. The main bronchi then branch again and again, first forming smaller bronchi and then even smaller bronchioles. At the end of the smallest bronchioles, there are tiny grape-like air sacs called alveoli. It is in the alveoli that oxygen comes into contact with the red blood cells that will carry it to all parts of the body. In the rare cases, when influenza goes on to cause pneumonia, the alveoli tend to fill up with water and cellular debris. This prevents the red blood cells from picking up oxygen and causes hypoxia. Hypoxia simply means low oxygen. This is the main problem for patients with pneumonia. Endoscopy. The photograph at left shows the inside of a normal duodenum as seen through an endoscope. An endoscope is a flexible tube with both a light and a camera lens at its end. Doctors often use the endoscope to examine the digestive tract when a patient develops vomiting or diarrhea that doesn't resolve as expected. Tiny surgical tools can also be manipulated through the endoscope, allowing treatment of a wide variety of digestive system disorders. Microvilli. The photograph at left shows a close-up of a mucosal cell which lines the inside of the small intestine. Each of the tiny finger-like projections on this cell's surface are called microvilli. If we were further away, we could see that the inner lining of the small intestine is itself organized into many small finger-like projections called villi. The villi and microvilli together create a surface area within the small intestine that is as large as a tennis court. The main purpose of this lining is to promote the effective absorption of food. This is a job it is quite well designed to perform. The small intestine. The illustration at left depicts a segment of the small intestine. The small intestine is a long tube, about 21 feet or 6.5 meters, whose purpose is to absorb food. The inner layer of the small intestine, the mucosa, is very well suited for this job. It is organized into innumerable little finger-like projections called villi. The mucosal cells which line the villi are in turn covered with even smaller finger-like projections called microvilli. The villi and microvilli greatly increase the surface area with which to absorb food. It is the mucosal cells which line the villi that are most damaged by a rotavirus infection. This disrupts the absorption of food and causes vomiting and diarrhea. The middle walls of the small intestine contain circular and longitudinal smooth muscle layers. Under normal circumstances, these muscle layers contract in rhythmic fashion to force the partially digested food along the whole length of the small intestine. This contraction process is called peristalsis. The outermost layer of the small intestine is called the serosa. Rotavirus. The illustration at left shows a single rotavirus. Worldwide, it is one of the most common viruses that can infect the digestive system and cause gastroenteritis. The rotavirus is easily spread from person to person in a family or other group setting. Rotaviruses are also found in a number of animal species. Rotavirus infection is particularly problematic in infants and young children, and it is responsible for many deaths in undeveloped countries, where medical care is inadequate. The rotavirus causes illness by invading the lining of the duodenum and the upper small intestine. The intestinal villi are transiently rotavirus. The illustration at left shows a single rotavirus. Worldwide, it is one of the most common viruses that can infect the digestive system and cause gastroenteritis. The rotavirus is easily spread from person to person in a family or other group setting. Rotaviruses are also found in a number of animal species. Rotavirus infection is particularly problematic in infants and young children, and it is responsible for many deaths in undeveloped countries, where medical care is inadequate. The rotavirus causes illness by invading the lining of the duodenum and the upper small intestine. The intestinal villi are transiently damaged, but they rapidly regenerate their lining. Illness typically begins with 1 or 2 episodes of vomiting, followed by diarrhea. Uncomplicated cases resolve in about 1 week. Treatment requires only rest and adequate fluid intake to prevent dehydration. Rabies virus. This is a picture of a rabies virus. The rabies virus is a member of a family of rhabdoviruses. Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also contract the illness if they are bitten by a rabid animal. Common animal carriers include foxes, skunks, raccoons, bats, and dogs. The disease usually begins 2 to 8 weeks after exposure to the virus. Early symptoms include loss of appetite, intense thirst, nausea, vomiting, and fever. The virus causes its ill effects by damaging the central nervous system. It is generally only a few weeks from the onset of symptoms until the patient lapses into a coma and dies. Untreated rabies is nearly universally fatal. Fortunately, treatment can prevent rabies from developing if it is initiated soon after the patient is bitten by the rabid animal. Antibodies. This picture shows several Y-shaped antibody molecules within a blood vessel. Antibodies are made by the immune system to react with specific foreign invaders, such as rabies viruses. Treatment for people exposed to rabies involves administering pre-formed anti-rabies antibodies obtained from horses. These antibodies bind to the rabies viruses and help the body to eliminate them before they can do any harm. Next, the patient is immunized with killed rabies viruses. These viruses stimulate the patient's immune system to make its own anti-rabies antibodies. Treatment is essentially 100% successful at preventing the disease when it is given within a few days of exposure to rabies. Of historical interest, it was Louis Pasteur who first explained the cause of rabies. He also developed a method of immunization to prevent the disease from occurring. In the 1800s, this was a monumental achievement. Neuron. The basic function of the nervous system is to transmit messages from one place to another. The nerve cells which do this job are called neurons. Each neuron has a single long branch called an axon, which permits messages to be carried to distant parts of the body. This illustration shows a single neuron with its axon, in yellow, extending off to the left. Normally, neurons perform their functions by conducting electrical signals down the length of their axons. Unfortunately, these same axons serve as the pathway by which rabies viruses migrate from the site of an animal bite to the central nervous system. The further away the animal bite is from the central nervous system, the longer it takes for the disease to develop. The brain. This photograph shows a human brain. It is dominated by the massive cerebrum with its many deep folds. Also seen in the photograph are the cerebellum, located at the back of the brain, and the brainstem. The brain and the spinal cord together form the central nervous system, CNS. The CNS is the control center for the body. The lethal effects of rabies viruses result from infection of the CNS. Without proper function of the CNS, vital functions such as breathing and swallowing stop working. Shutdown of the CNS eventually leads to coma and death. The most reliable method for determining whether an animal is infected with the rabies virus is to examine an actual brain specimen for the presence of rabies viruses.
Doctor, I was bitten by a crazy dog yesterday and I'm really scared. The bite hurts a lot. I wasn't even doing anything to the dog. My mom's worried I might get rabies. She said you were gonna stick me in the stomach with a bunch of really big needles. Can I leave now? You have been transported into the patient's brain. Find and zap all of the viruses to cure him. Remember, your patient was bitten by a mad dog just yesterday. Avoid damaging healthy cells. Hurry! Time is of the essence. Oh no! You zapped a nerve cell! The nervous system contains many billions of neurons, nerve cells. However, neurons do not grow back after they die. A baby starts its life with all the neurons it will ever have. Many neurons may be damaged by a serious infection. Fortunately, people are born with a great excess of neurons. Oh no! The patient is now in critical condition. This procedure has been terminated. Stand by for unit reset. Please attempt the procedure again immediately. Doctor? I was bitten by a crazy dog yesterday and I'm really scared. You have been transported into the patient's brain. Find and zap all of the viruses to cure him. Remember, your patient was bitten by a mad dog just yesterday. Avoid damaging healthy... Great job! You cured the patient of rabies. Rabies is a viral infection of the nervous system. The virus is transmitted to humans by rabid animal bites. Many cases are the result of dog bites. Raccoons and bats are other common carriers. Worldwide, there are an estimated 15,000 cases of rabies each year. There are very few cases in the U.S., however, largely as a result of intensive efforts to vaccinate dogs. Untreated cases are usually fatal. Treatment is given to patients when there is reasonable suspicion of rabies exposure following an animal bite. The primary treatment involves a several-week course of anti-rabies antibody shots. The treatment works by enabling the body to eliminate all the rabies viruses before the disease develops. Fortunately, the medicine has changed and it is no longer administered through the stomach. Ow! Oh, that hurts. Don't poke me in the belly like that. Oh, my stomach's been hurting since yesterday morning. I vomited twice yesterday and now I have diarrhea. Today I even collapsed at work because I felt so lightheaded. Doc, please help me. I'm feeling really sick. You have been transported to the patient's lungs. You will need to go exploring to find all the viruses. Your mission is to eliminate the viruses in order to cure her. Remember, she has been suffering from nausea, vomiting, and diarrhea for 2 days. Avoid zapping healthy cells. Hurry! Marvelous work! You cured the patient of gastroenteritis. Gastroenteritis is a common cause of abdominal pain and vomiting. It is caused by any of a large number of different viruses or bacteria that a person may be exposed to by consuming contaminated food or water. This case of gastroenteritis was caused by a rotavirus infection. Symptoms can vary from mild to very severe. Generally, gastroenteritis lasts only a few days and resolves without any problems. Treatment depends mostly on replacing lost fluids. It's time to see another patient.
Doc, I've been feeling terrible for 3 days now. I can hardly move. Never been this sick before. I have a high fever. I'm having a hard time breathing. Keep coughing and coughing. Hardly anything ever comes up. Tylenol helps make my fever go down, but I still feel like I'm gonna drop dead. Please help me. I just don't know what to do.
You have been transported to the patient's heart. You will need to go exploring to find all the viruses. Your mission is to eliminate them all in order to cure the patient. Remember, he has been suffering from fever, cough, and shortness of breath for several days. Avoid zapping healthy cells. Hurry! Every second is critical.
Great job! You cured the patient of pneumonia. Most cases of pneumonia are caused by either bacteria or viruses. In this case, the patient's illness was caused by an influenza virus infection. This is a very unusual cause of pneumonia. Although there is no specific therapy for this viral illness, it is difficult to distinguish influenza virus pneumonia from the more commonly seen bacterial pneumonias. This patient would thus have been treated with antibiotics, as if he had a bacterial pneumonia, such as pneumococcal pneumonia. A failure to respond to antibiotics as expected is often the clue that signals doctors to look for an unusual viral cause, as in this case. It's time to see another patient. Doc, for the past few months, whenever I walk up the stairs in my house, I feel pressure in my chest. Pain has been getting worse lately. Sometimes I even feel pain in my jaw, my left shoulder. And when it's really bad, I have to sit down for a while. The pain seems to go away. I don't know what to do, Doc. This is making it hard just to get through the day.
You have been transported into the patient's stomach. Find all of the cholesterol plaques in the patient's arteries and zap them. This will relieve the patient of his disabling chest pain. It will also eliminate the abnormal whooshing sound heard in the patient's neck. Avoid zapping healthy cells as it will cost you valuable time.
Very well done. You cleared the cholesterol plaques from the patient's arteries. The patient had symptoms of angina pectoris. Angina occurs when the oxygen supply to the heart muscle is inadequate to meet the heart's demands. The heart is deprived of oxygen, and the patient experiences pain. Most commonly, angina occurs with mild stress or exercise. Angina is caused by narrowing of the coronary arteries, usually due to a buildup of cholesterol plaques. The pain can be relieved with medication, but definitive treatment requires intervention to restore normal blood flow to the heart muscle. Coronary balloon angioplasty and coronary artery bypass grafting are the most common methods of definitive treatment. Congratulations! Now see if you can cure all the patients faster.
You have already cured this patient. You should go on to the next patient while there is still time. Unable to commence procedure. Unable to commence procedure. Please interview the patient first. The history and physical exam are still the most important parts of the diagnostic process. In general, lab tests and X-rays are both only means to confirm or refute a diagnosis made on the basis of the history and physical. It is unacceptable to jump into the virtual medical unit without first interviewing the patient. You should also click on the Diagnostic Information console to learn more about the patient. Doctor? Oh no! You zapped a red blood cell! Red blood cells make up about 40% of the blood volume. When doctors measure this number, it is called the hematocrit. Sometimes the number of red cells in the blood goes down, either because too few cells are being made or because they are being destroyed prematurely. This is called anemia. Under normal circumstances, a red cell stays in circulation for about 120 days before it is removed from the blood by the spleen. You zapped the lung cell! The trachea and bronchi are lined with cells that have tiny hairs, cilia, on their surface. These hairs continually move back and forth in a sweeping motion to help eliminate foreign material from the lungs. Respiratory tract infections of any type damage these cells and make it more difficult to clear fluid and pus from the airways. Viral pneumonia typically involves both lungs, while bacterial pneumonia frequently involves only a single lung. Oh no! You zapped an intestinal cell! The lining of the small intestine is designed to absorb food particles. This lining is covered with many small finger-like projections called villi. The villi are in turn covered with cells whose surfaces have many tiny finger-like projections called microvilli. These intestinal lining cells normally have a short lifespan of only 4 to 7 days. This is shortened even further by an infection, which may severely damage the intestinal lining. Oh no! The patient is now in critical condition. This procedure has been terminated. Stand by for unit reset. Please attempt the procedure again immediately.
Welcome to the main menu of Navigator. The